Hi, Laura here, Front Office Rocks. Thank you for joining me for another video on our YouTube channel. I'm super excited that you guys are here checking out the videos. I'm getting a lot of questions from viewers, so I'm super excited about that. And I just got a question recently that I wanted to address that's not a really easy one to answer. But it's a good discussion to have. I don't think I've ever really talked about this when I'm speaking or in front of clients. I know that I do have videos on this on Front Office Rocks. In case you didn't know, on Front Office Rocks, we also have Back Office Rocks, which is clinical training, hygiene training, assistant training, and doctor training. And in our doctor videos, we actually talk about this topic. So let me just get to it now that I've kind of talked in circles. What do you do with the patients who love you, love your doctor, but are being seen other places for treatment? An example of that is we had patients who loved our office for cleanings and our hygienist, but then they left and went to another doctor to get crowns because they were less expensive. Or they love our doctor and they get the treatment done at our office, but they go to a different practice because of their insurance to get their cleanings. And I'm not talking about the ones that go to specialists. You know, if they go to the specialist that we refer them to because of perio needs, then that makes sense. But I'm talking about the ones who kind of pick and choose what they do in your practice and what they do in other practices. That's a judgment call. That's a hard one. My 2 cents on that is if it makes sense to you, right? If it totally is okay with your practice and your doctor, then it's probably okay to do it. However, many times the patient is dictating this and that it's not okay with the doctor and the clinical team or the hygiene team. Meaning, you know, they're getting diagnosed at our office for something and then they're going to another office to get the work done. You know, we're not a pick and choose, you do some here, some there. We're here to take care of your mouth comprehensively. That means your cleanings, your restorative, and everything. So you have to have a discussion, your doctor, your team, you guys have to have a discussion with the patient to really set up the boundaries of what's allowed in your practice and what's not. And if this is something where it's out of your ethical comfort zone, if it's out of the doctor's comfort zone, then really the patient shouldn't be able to pick and choose where they go. If you're fully going to take care of the patient and you offer hygiene and you offer a restorative and they love you, they need to be coming to you, because it's like seeing 2 or 3 different people for the same thing. We need one person to be taking care of our patient and their dental health. Now, like I said, there might be extreme situations where, I don't know, their sister's a hygienist at a practice and they love their sister, but they don't like anything else about the practice, so they come to you for the dental work or something. There's always extenuating circumstances. But overall, I believe that if you're fully going to care for your patients, then the patient needs to be in your practice completely for the treatment that you offer. If you need to refer them out to a specialist for something like placing an implant or root canal, okay, we do that, but then they come back to your practice because at the end of the day, you're their healthcare provider. You're the one who's taking care of this part of their body, and that includes all of this. And it's my opinion that they can't just dictate their own dental treatment, that they really need to go to one provider who's going to kind of quarterback the whole thing, okay? Don't quote me on this, but I have heard, right, from other people who've spoke talking about no matter what people sign off on, no matter what waivers you have them sign, in a court of law, if you're their dentist and they don't get treatment done and they signed every waiver in the world, you're still ethically responsible for them. That's supervised neglect if they're not getting the dentistry done and you're just allowing it to get worse. I would assume it's similar when they're going to different providers and getting different things done. Ultimately, if you're seeing them, you're their healthcare provider. So I would be really clear with the patients that you're there to take care of them, what you allow in your practice and what you don't allow in your practice. And if you're clear with them and you explain to them that you're there to take care of them and that you're looking out for the best interest of them, they're going to make the decision whether they're going to stay in your practice or maybe go somewhere else. And honestly, we don't have to be the dentist for everybody. If they just feel like they're better suited somewhere else, then that's okay, right? Ultimately, it's about caring for our patients and caring for our practice and making sure that we're doing the right thing. So again, like I said, that's not an easy question to answer. Every scenario is different, but you do want to make sure that you're doing ethically what's right for you and your practice and fully taking care of your patients. So great question. Thank you. Please send more questions my way. I love these. These are great. They're getting me thinking and challenging me, which is always fun. So I appreciate the questions, and make sure you subscribe and set the notifications so you know when the next one comes out. And until then, if you need anything else, we are available over at Front Office Rocks.